Wednesday, May 1st is Doctors' Day across the province. It's a day to recognize and celebrate our physicians and their dedication to keeping us all healthy. We welcome Dr. Lorraine Jensen. She's the Chief of Medicine at Niagara Health. Dr. Jensen, how long has this day been a thing?
It's been a thing since the provincial government in 2011 decided that physicians should have a day of appreciation. And I really love the day that they chose because it is Dr. Emily Stowe's birthday, who was the first female Canadian physician. So I think it's a time to reflect on what we're doing currently and also how far we've come as a profession.
Over the last few years, a lot of the focus has been on, how overworked and how difficult the job was for doctors during the pandemic. We're beyond that right now, but we're still experiencing some of the effects of what those years meant to us.
Absolutely. And so I think a lot of what's happening now is a recovery plan and how to move forward from the pandemic. And physicians have really been frontline in developing those plans and also executing them.
When you look at this shortage that we've had of physicians in Niagara, is that being addressed right now by Niagara Health?
Absolutely. So Niagara Health has done a lot to recruit physicians both to Niagara Health and also to support the recruitment of physicians to the community. So I'm happy to report that in the past year we have recruited 52 physicians to Niagara Health, including in high need areas such as anesthesiology, emergency medicine, internal medicine, and hospitalist-based medicine. And also very happy to report that Niagara Health created a new position called the Chief of Primary Care, and that's really to help recruitment of family physicians to the community and to help strengthen those community ties.
The family physician is someone that we really do have to consider when we talk about Doctors' Day, because that's our first point of contact.
Absolutely. I admire physicians that work in family practice so much, and I know as a hospital-based physician, I couldn't do my job without them.
What is going on in the hospitals right now to promote Doctors' Day as it comes up on May 1st?
So there's a lot going on in terms of social media. There will be a lot of recognition leading up to Doctors' Day and on Doctors' Day itself, both from Niagara Health, from the Ontario Medical Association, and from the community. Niagara Falls will be lit up again this year in blue between 9:45 and 10, and the City of Welland is also lighting up one of their bridges, which I think is really great.
When we look at the life of a doctor, there are so many demands on a doctor.
There are. I feel those every day.
And you've been here in Niagara Health since 2015, that's
correct, yes. I finished my medical training at the University of Toronto and moved to Niagara shortly thereafter.
Tell me about your life through Niagara Health. You haven't always been the Chief of Medicine.
No, I joined as a general internist, so I'm trained as a general internist. So I still practice pretty much full time and also do palliative care. And then I moved into leadership in 2017 when I became the site lead for GIM, General Internal Medicine, at the St. Catharines site, and then took on the Chief of Medicine in December of 2020, so smack dab in the middle of the pandemic.
And you can attest to the hard work that you had to do at the University of Toronto to get through your medical training and your internship and all of that. It's a very demanding procedure to become a doctor.
It is very demanding. I think, the training, the studying, but it doesn't end when you leave training. And that's why I love Doctors' Day, is it's the ability to recognize the sacrifices that physicians have made throughout their training, throughout their career, and really their commitment and conviction for patient care.
Is Niagara Health still in need of more doctors?
Absolutely. We continue to recruit, so we have invested in physicians who are in leadership roles within recruitment. So for instance, we have a recruitment lead for the Department of Medicine, and Niagara Health has also reached out to external recruitment firms to help with shortages such as in the Department of Anesthesiology.
And we know that Niagara Health is also, I don't want to say in flux, but there's a lot of changes coming.
Correct.
With the new hospital in South Niagara and some revamping of some of the services. That is a promising thing for these new doctors coming to Niagara.
I really think it is. I think the South Niagara site will be a great way to recruit the best and brightest coming out of medical training. We have physicians in leadership roles that are helping with that development plan. We are also going to get a new health information system, or HIS, and that will be coming in September of this year, which is a big change, but a good one, because physicians that are training in academic centers are used to having that full HIS. There's also the fairly new Niagara Health Knowledge Institute, and so there's a lot of research going on at Niagara Health. They've really been instrumental, and Dr. Jennifer Sang is is a great physician leader within Niagara Health who is pushing forward community-based research. And so I think all of those things will help to recruit physicians to Niagara Health.
I love Dr. Sang, and there's a perfect example of someone to consider. We should all consider doctors on May 1st and every day, really, but especially on Doctors' Day. Dr. Jensen, thanks for joining us.
Thanks so much for having me.